I'm Dr. Harish Prasad. I'm an MD dermatologist and a dermatosurgeon practicing at Vitals Clinic, Bangalore. We have clinics at BTM second stage and Electronic City phase 1. Now coming to acne scars laser sessions. Now many people ask how many sessions are required for acne scars to be reduced. Now what we have to understand is there are various types of acne scars. The ice pick scars, rolling scars or the box scars. Now at Vitals we evaluate what kind of scars you have and then plan your procedures. The treatments available at Vitals are like subcisions. We do lasers like MNRF, CO2 and we do in combination of these. Now when you come to Vitals, we evaluate what kind of scar you have and then plan which kind of laser or which kind of combination works better to you. We also do surgical treatments like punch excision, punch flotation and punch grafting if your scars are very stubborn even for lasers. The number of sessions which are required for lasers usually are around 4 to 6 sessions based on your scar type, and when we do combinations, your number of sessions might reduce. Do you see complete reduction of your scars? No. You have to understand this, that at least 50 to 80% of the scar reduction will happen. Visible results will be very outstanding. So you'll definitely see the difference when you do all these procedures. Now, why do you require so many sessions? Is because all the laser technologies will work on the principle of collagen remodulation. Collagen remodulation takes around 1 month's time. Depends on your skin type, your healing capacity and your pigmentation tendency. The number of sessions varies from patient to patient. So ideally, we have to do around 4 to 6 sessions of lasers like MNRF and fractional CO2 laser.